Today we're going to be going over what happens during a concussion. So just a bit about concussions. They are a type of traumatic brain injury, and they occur when a force is applied somewhere to the body and it travels up to the brain and causes the brain to shake inside of the skull. So a lot of times this force does occur straight to the head, but it also could occur to other parts of the body, and that force can travel up to our brain. So when the head shakes like this, and the brain bounces around in our skull, a complex spiral of events occurs. This complex spiral of events is called the neurometabolic cascade. Basically what happens is the energy supply is no longer balanced with the energy demand of our cells. So within our brain and spinal cord, we have some nerve cells that are called neurons, like you can see in the image. So when the force hits our body, it gets transmitted up to the brain, and the force first arrives at that neuron. The nerve cell has some little arms that pass the signal along to another nerve cell. When it does this, chemicals are released to give a message to the next cell. So the shaking of the brain stretches out the neuron, and some potassium particles, which you can see represented as K, it's a blue K, they spill out of the neuron. The cells try to make more energy through a process called glycolysis, which increases the calcium particles in the cell. So you can see calcium is represented by the pink Ca in the image. This increase in calcium decreases the amount of blood that's flowing to our brain, which then decreases the function of the nerve cells to create energy, which we call metabolism. The body then finds itself in an energy crisis where energy demand is much greater than the energy of supply that we have by our cells. While we're in the state of an energy crisis, another injury to the brain could cause serious cell damage or even cell death, which can lead to permanent life-altering injuries or even death. That's why it's so important to be honest about any concussion symptoms that you're showing and to follow appropriate treatment protocols. So how this affects the athlete is different parts of our brain do different things. As just some of them you can see in the image in the upper right-hand corner. So because of this, wherever the force hits our brain can determine the type of symptoms that we have when we have a concussion. So just an example, you can see here that the occipital lobe, which is in the back of our head, does sight. So if we have a force that's transmitted to the back of our head, we might have some vision issues or different visual symptoms. So if you're an athlete here, you want to make sure to tell your athletic trainer if you're exhibiting any of these concussion symptoms, and to be honest about your symptoms throughout your treatment sessions and throughout your return to school and return to play protocols so that we can prevent you having an even more serious injury.